You know, my life has not been easy. The breast cancer came first, and then several years later, the brain aneurysm. So it was difficult, but it was a blip on the screen. And that's what this is, another blip on my screen. I'm a grandmother of 6. I have 3 phenomenal children. 3 or 4 years ago, I was diagnosed with idiopathic pulmonary fibrosis.
Idiopathic pulmonary fibrosis is a chronic progressive lung disease that's characterized by both inflammation and progressive scarring in the lungs. It's not a reversible condition, and it's not curable.
I have difficulty vacuuming, making the bed. Things I normally would do, I can't do anymore. Cold air triggers coughing, so I have to be careful. I have a huge collection of scarves because I cover my face when I go out. I tire much easier. Find I can't do some of the social things I used to because it's just, I'm slowing my friends down. I never heard of anybody that had pulmonary fibrosis. It's not a well-known disease, and I don't think people understand the severity of it.
The movement that you see in the pulmonary fibrosis world really simulates a lot of what's happening in the cancer world. Now the goal is trying to find better drugs, better combinations of drugs. This idea of precision medicine, personalized medicine, ultimately the goal is cure it, at the very least have no progression of disease. We are closer to that now than we've been any time in the last 15 years.
Sandy's disease has shown mild progression over the last 5 years. We're hopeful that the trial that she's about to enroll in will help to stabilize her condition. Sandy's enrolling in a clinical trial where she'll be taking one of the FDA-approved drugs, pirfenidone.
You look at a patient like Ms. Sherman, an individual that has a really severe disease, who despite that has remained optimistic, has participated in multiple clinical trials, undergone fiberoptic bronchoscopy. That's the kind of thing that drives us.
I had a bronchoscopy, but he told me it will not help me. But what he's hoping is when he does the comparisons of the tissues and the cells, maybe it'll help somebody else. If I can help somebody, even one person, I mean, that makes it worthwhile. I taught for 45 years. I get so much satisfaction when they come to me and say, "You really helped me. You made it so much easier. You've been there to explain things," because if I can make it better for them, then I feel better, like I've done my job. You're not defined by cancer, you're not defined by brain aneurysms, you're defined by the life you live. It might have been a difficult road, but we came out okay.